Dr. Erin Dotson and Dr. Paul Jones, thank you very much for being here with us.
Yes.
And you brought all of this with you.
Absolutely.
It's incredibly important. Let's start off with the basics.
Yes.
What is CPR?
CPR stands for cardiopulmonary resuscitation. And CPR is so important because every year, annually, according to the American Heart Association, approximately 356,000 people die from sudden cardiac arrest.
Wow.
So that's why it's important. And we're also going to be acknowledging and celebrating CPR and AED Awareness Week. It's June the 1st through the 7th.
Yes. Well, let's get into the demo. Some of us have done it, but it's been years. So walk us through the best way here to get the demo done.
Okay, first, if we identify a person whom is unresponsive, right? The first thing we want to say is, hey, 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 are you okay? Are you okay?
Okay.
Okay, the person non-responsive, then we want to say, hey, you. We always want to identify someone with a yellow dress on, or yellow suit, or black suit. Hey, you with the yellow dress, call 911 and get an AED. Okay, those are the first things that we should do when we identify someone as non-responsive. Is first, let's activate the 911 system.
Great.
Okay. Once we do that, we're going to check for a carotid pulse, and it's always going to be on this side.
Now, doctor, you are a specific space, right? You want to be on a certain side. So let's talk about that.
Yes. So we want to be on the side of the patient. We're checking for the carotid on the side that we're on.
Great.
We're not going to check on the opposite side. We're checking for the pulse on this side. We're listening for any breath sounds or feeling any breath. We don't see a rise and fall of the chest. Then we're going to do 30 compressions and 2 breaths. Okay, so let's go. 1, 2, down further, 3. So, and we want to go as deep as 2 inches to 2.4 inches in depth, okay?
Okay, so we're really getting in there.
Yes. Yeah. If we do not see a rise and fall of the chest, we reposition the head, okay? Bring it back down, bring it back up, pinch the nose, and again, we're watching the rise and fall of the chest.
Now, doctors, I have to ask you, because there's obviously a lot of force.
Yes.
So let's talk about the fear of breaking a rib, of any kind of injury. Would you talk about that?
Yes.
So we definitely know the main objective is saving a life, and fracturing a rib is possible, but it's just a hairline fracture. But we just want to make sure that you are saving that individual, that person's life. So it's bound to happen, so don't be afraid of that. But we want to make sure that we're doing the compressions deep enough to ensure that we're getting the oxygen to the brain.
That's right. Okay. Wonderful.
Okay. Now, this is for an adult.
Yes.
Infants, I would imagine, have a higher likelihood of choking than an adult.
Yes.
So you may be faced with this in a more immediate way.
Yes.
And they can't really communicate with you that they're choking.
Correct.
So what are we looking for with the child?
So with a child, we're looking for a child that's not breathing, right? And so the child is not choking, but he or she are cyanotic, right? When I say cyanotic, we're looking at the discoloration around their lip area. It's like a purplish blue color. Okay, and so that's how we know that this child is having some challenges with breathing, right? So that's what we're looking at, and we're paying attention to that. So with a child, unlike with adults, we can't say, hey, 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 are you okay, right? Because they're not going to respond anyway. But we want to check for a brachial. A brachial pulse here for 10 seconds.
Okay, so inside of the arm.
Inside the arm? Okay.
Yes. And you use your 2 fingers here, and we're checking here. Okay. And then we see the child is not, the infant is not breathing. Okay. With the difference between an adult and infant, our mouth is going to cover the mouth and nose. Okay, because they have a small face, so we're covering. So unlike with the adults, we pinch the nose and tilt the head back. With the infant, we're covering the mouth and the nose. And with the infant too, our compressions are here. Okay. And we're still doing the 30 compressions to 2 breaths. So we're 1 and 2 and 3 and 4 and 5 and 6 and 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Okay. And then we come here and we give the breath. And again, we're covering both the mouth and the nose. And again, we're looking for the rise and fall of the chest. Now, keep in mind too, we are going to continue these life-saving measures until either EMS arrives and or this person begins to start breathing on his or her own. But it's still important that they still need to be checked out by a medical professional.
Well, to that end, would you talk about what an AED is? I know these are Very important tools as well.
Yes, thank you. So an AED, these are automated external defibrillators. So we see some of these bigger machines in the hospitals, right? But these are machines that we can find in airports, maybe some grocery store areas. But you will see these, and it tells you exactly what you need to do. If you press this button.
Okay.
Thank you for giving us a demo here.
Do not touch the patient. Analyzing heart rhythm.
So this tells you exactly where to place your pads. Okay. Okay. So you place your pads on the patient. It tells you exactly where they need to be placed.
Advised.
Okay.
Charging. Stay clear of patient. Deliver shock now.
And it's going to administer
Press the orange button. Shock delivered.
Okay.
Wow.
So the good thing with this machine here, so even if we have this machine available and we don't have to start chest compressions. If this is available, readily available, put these pads on that person and allow this machine to tell you what to do. It's going to walk you through step by step what to do, when to do the chest compressions, when to stand back so the shock can be administered. And I also like to make mention too, with infants, while we do have pads for infants as well, but if you do not have a pad for an infant and you see one of these machines, we will place a pad here on the chest of the infant and the back of the infant.
Oh, wow.
Okay.
Wow. Still use it.
So we can still use it. But it's not interchangeable, right? We can't use an infant pad on an adult.
Okay.
Right? Okay.
That's an important note.
It's an
and
important
again,
note.
I just want to be clear. You had said if there is an AED available, you would go to this first before compression.
Yes.
Okay.
Yes,
That's an
ma'am.
important note.
Because again, the this AED, this automated external defibrillator, is going to analyze a heart rhythm. So when we go into a sudden cardiac arrest, we go into ventricular fibrillation, right? It's the type of rhythm. There are several type of rhythms when we talk about cardiac arrest, right? And so this is a rhythm, and it's going to analyze that rhythm, and it's going to try to shock the heart back into a normal, what's called sinus rhythm.
Okay, I think our last question here. This, by the way, thank you both so much.
This is so helpful.
Really important information that honestly I did not know. I don't know how to do CPR. I know about the defibrillators or AEDs, but how long can a brain go without oxygen flow? Because time, I know, is of the essence.
Especially with babies.
Yes, it is.
So a brain can go without oxygen 1 to 4 minutes. But after the 4th minute, then the damage is irreversible. So that is why it's important for all of us to know CPR and have an AED available, that we're all trained appropriately so we can make sure that we're getting that oxygen back to the brain, because once that damage is done, it's irreversible.
Is the 1 to 4 the same with infants?
Yes.
Okay.
The 1 to 4 is the same with infants and adults.
Okay.
Wow. Thank you both so much for this
Yes,
critical
so many
information.
helpful.
I know that some people have learned some things. I know I've learned some things, and we appreciate it.
Yeah.
Thank you for having us.
Great.
Thank you so much.
Thank you so much. We'll have all the
you.
information on atliveshow.com.